I was coming back from a job south of Watford, and I was coming down BI 30, and I turned around. I was coming around a sharp curve. It was in a 25-mile-an-hour children's zone, and I had a kid from Louisiana came around there about 70 and on ice and slid over in front of me and hit me head on. The Mandaree ambulance was the one that was called out. Keene Fire Department was called out to cut me out of there. In the meantime, there was a lot of people that I found a lot of coats in my old cab of my truck that had names on them, and those names represented people that took their coats off and covered me up and kept me warm. I don't really remember a lot that went on during 11 or 12 days I was in the hospital. I woke up, I remember waking up in the hospital. They were putting stitches in my head. What do I remember? I remember a couple priests coming in to see me. I remember a sister coming in and a couple people saying the rosary with me. Like I've told everybody, I just kind of remember that you know, there seemed to be somebody with me all the time taking care of me. I struggled to walk, and I struggled to sit in a chair, and I got some people motivated me to go and try water walking. And after a couple weeks of water walking, I was walking a little bit, and then I got up on the track upstairs, and the first week I walked an eighth of a mile, the second week I walked a quarter of a mile, and third week you know, half a mile, and after about 2 months I was walking. Around about the 10th of December is when it was about the first time I could ever sit in a chair and watch TV. So I was able to, the rec center helped me out a lot. After I got a settlement from the accident, it wasn't enough. It just wasn't. I never got, you know, I didn't really have enough money or income to take care of myself. I just started investing myself. I've done investing for, you know, for about 40 years, and I was just so blessed to be able to make a small fortune trading commodities. And after that, I wanted to share that money that I made, or, you know, some of the profits that I made, and back to the people that took care of me. And specifically here in Dickinson, to show my appreciation to the people that helped me and took care of me. That was so very, very important for me. Part of this donation was not just because of the accident, but it was also because of probably the 6 or 7 years before the accident that I worked in the oil fields, and I worked in very harsh conditions. And Desiree and Tina just took care of me completely. Just always just made sure that I would have never been able to keep going to the oil fields without her. Every time I give, I feel so much better. Many times I just don't necessarily give to help others. Half of why I give is to help myself. And that's one of the reasons why I give. So it's such an uplifting experience for me to give. It's just paper. It's all it is. So it's if you have enough to take care of yourself, that's all you need. And I think instead of just leaving it sit in an account and draw a little bit of interest, you know, try to do something good with it. Try to help people with it, and do something good with the resources that you have, or the money that you have, to make a difference in other people's lives.